We'll get started. Can everybody hear me? We're supposed to have this mic lift system, but it doesn't seem to be working, so we have a back row says we're good. Okay, wonderful. Good afternoon, everybody, and on behalf of End Homelessness Winnipeg, I'd like to welcome you to the launch of the 2024 Winnipeg Street Census. We also lovingly know it as the Pit Count, so you might be familiar with either term. My name is Jackie Hunt. I'm the Senior Director of Strategy and Impact with End Homelessness Winnipeg, and I'll be your MC for this afternoon. We're honored to have you here today as we reflect on this important work and the collective effort that it represents. I want to begin by acknowledging that End Homelessness Winnipeg, we honor the land and the water that sustain life. We recognize that Indigenous peoples have lived in relationship with this land since time immemorial through survival, shelter, sustenance, and in harmony with Mother Earth and her gifts. Land acknowledgement has always been integral to the Indigenous prayers, ceremonies, and gatherings. We're honored to be located on Treaty 1 territory at the sacred crossroads of the Red and Assiniboine Rivers, a historic gathering place for the Anishinaabe, Ininiwak, Anishinaabe, Dakota Oyeti, and the Denisoonilini people, and the national homeland of the Red River Métis. We acknowledge that the water we rely on comes from Shoal Lake and has been cared for by First Nations in Treaty 3 territory for thousands of years. As an Indigenous organization, End Homelessness Winnipeg is tasked with addressing homelessness in the city of Winnipeg, including the extreme overrepresentation of houseless individuals of Indigenous descent. Through this acknowledgement, we commit ourselves to being truth tellers, stewards of the collective memory of Canada, and active participants in reconciliation. Acknowledging the ongoing impacts of colonization, we honor the sacred responsibility with shared generations past and present to protect the land and water and to uphold the dignity of Indigenous peoples and to work towards the restoration of belonging, dignity, and home. Elder Walter Richard has been integral on the steering committee for the Pit Count. He's been a strong voice along the way, and he was scheduled to bring opening prayer today. Unfortunately, he had an emergency that kept him away from us today, but I do want to acknowledge that Walter held a pipe ceremony yesterday in honor of this event, and we thank him for that, and we acknowledge that Elijah went out to visit him at his home yesterday to offer him tobacco, and they had a really nice conversation, so that was wonderful. But with that, we are so grateful that Barbara Nepanak, Elder Barbara Nepanak, is stepping in at the very last minute, and we are so grateful for your time today, and we're going to appreciate your kind words that you're going to bring in our opening prayer. And so for that, I will pass the mic over to you.
Thank you for that, Miigwech. Yeah, it's very sudden that I got a call a couple hours ago. I should have been on my way to Kenora. They'll just have to wait for me. That's okay. You know, my late husband would always say, be there for the people when they need you. So I make every effort to do that, to live up to his legacy of his commitment to community. My traditional name in my language is
This event, just like the pit count itself, brings together thoughts, voices, and hearts from community and government. I'd like to take this time to invite the Honourable Bernadette Smith, Manitoba's Minister for Housing, Addiction, Homelessness and Mental Health, to provide remarks on behalf of the province of Manitoba.
All right, good afternoon, everyone. It is hot in this room. Wow, I haven't been in this university for a while, so we're obviously in the older part where there's no air conditioning. So good afternoon, everyone. I just want to say thank you to Barbara for that beautiful prayer and opening us up in a good way in such a short period of time. So taking over for Walter and for that pipe ceremony that he did on behalf of the pit count. So I want to thank everyone for taking the time out of their day to be here, and to thank End Homelessness Winnipeg for doing this report and leading the street census. I especially want to thank all of the volunteers that went out in November, did the pit count for 5 days. You know, expanding the methodology has really helped capture the full picture. We know that the number has always been higher, that we haven't always been able to capture the full picture. So this certainly has really helped do that. And you know, this is really hard work. When my parents came to Winnipeg before I was born, my mom came from Ontario, my mom came from a First Nation called Pine Creek, which is just outside Dauphin, and my dad came from Ontario. When they first came to Winnipeg, they were both homeless, and they lived in a shelter. And it's important that we have supports and help capture, so we have those pictures so that we can help support those folks when they come. So the work that you're doing matters. Many of us know that not everyone understands homelessness, and that it's a complex issue shaped by poverty, trauma, discrimination, and the intergenerational impacts of colonization. So to address it effectively, we must understand both the pathways that lead people into homelessness and the barriers that prevent them from securing and maintaining safe, stable housing. So in January, we launched Your Way Home strategy. And that strategy really helps to secure and maintain housing for people. So many of you are involved in that strategy. So it's really about not just putting folks into housing, but really ensuring that they have the proper supports. Because for far too long, we've seen people go into housing, not be able to maintain that housing or have the proper supports to stay in housing. But now we have, you know, folks who are properly resourcing these folks to ensure that they're getting the proper services and that they have the supports to get onto a path of success, whether that's reuniting with their families, getting into a program where they can get some skills to get back into school. I had a son when I was 16. I was in a very abusive relationship. I was financially, tied to my relationship, so I couldn't just leave my relationship. When I did leave, I accessed housing, Manitoba Housing. I was able to get out of this relationship. I went back to school, but it wasn't on my own. I had to have support services. And that's exactly what we're doing, is we're supporting people, meeting them where they're at, so that they can realize that they can have a future. And that's exactly what Your Way Home does. It helps people realize that they have gifts, that they can have a future, that they can go into the jobs field, that they can live on their own independently, and that they have people that believe in them. Because this is hard work, and you're all doing hard work, and you believe in these people, and you're helping, and you're doing it with love and caring and compassion. So I just want to acknowledge all of that. And we fully recognize the challenges of collecting accurate data on homelessness. Given its hidden and transitional nature, this is why the efforts of expanding the number of volunteers and strengthening the street census methodology is so valuable and is really so appreciated. The greatest challenges before us is, of course, affordable housing. That's why our government is investing more money in affordable housing. We're also investing more money in maintaining affordable housing. So when we came into government, there were a lot of boards on our Manitoba Housing, which is a crown jewel. That's our biggest crown jewel, or one of our biggest crown jewels in government. We've been putting money in to take those boards off to get folks into Manitoba Housing. We've committed 20% of our Manitoba Housing to a Housing First model, which means folks that go into those 20% get wraparound services. And many of those folks that are here, well, there's a few folks here today that are providing those services in our Manitoba Housing units and then in other places and spaces. So we're taking a different approach. We're partnering, investing, and building. We have partnerships with End Homelessness Winnipeg, with municipal governments. We're happy that we're partnering with the City of Winnipeg. So we've been collaborating with them, and it's been a great partnership, whether it's with organizations, whether it's with the city, even the federal government has helped. So we're all coming to the table. We've had private folks that have come to the table as well. So we're all doing it together. We can't do it alone. It takes all of us. And when we say that village, we're a village, and it's going to take all of us. And a lot of people have been doing this work for a very long time. And I want to acknowledge the work that you've all been doing for a very long time. And you've been doing, tremendous lifting. So finally, I really want to acknowledge the most important contributors to the street census. And these are our unhoused folks who tell their stories. They tell it over and over and over again. And I've talked to folks who have been in encampments for a very long time. Some of them have never accessed the shelter system. They have undiagnosed mental health issues. They've lived in encampments for a very long time, and they just didn't feel safe anywhere. And now they have a place to call home. Folks that we've housed so far, 77 folks have been housed, and these are folks who are stable. They're stably housed. They're happy, they feel supported, they feel the loving compassion and caring from the folks who are providing the wraparound services. And each and every day, the outreach teams that are going out and providing that outreach to those folks are providing with love and compassion, and they know that these folks care about them. And like I said, the biggest barrier to the work that we're doing right now is affordable housing. And we are working on building more social and affordable housing and getting more online. So that's why our government, when we came into government, we created this ministry, because this is a priority for us. People are a priority. We need to get people out of tents into homes with the services that they need so that they can live a life of success. So really, I want to thank everyone who contributed to this, especially our unhoused folks who, told their stories, who helped be a part of this. And really, changing the methodology has really helped us capture the full picture. And we're on track to, get these folks housed, get them the supports they need. And no person, in this country should have to live without a home. So again, thank you, Miigwech, for the work that you're doing, and we can't do it alone, so thank you.
Thank you so much for that and your shared experiences with that. I think that resonates a lot with the folks that are doing that good community work here, so thank you. What I'd like to do now is I'd like to invite one of our board members, Justin Woodcock, to bring some greetings on behalf of our board of directors. I'll move my notes out of the way this time. Thanks, Justin. Thanks.
Danse, good afternoon, everyone. Justin Woodcock, Nitsi Kashin. My name is Justin Woodcock. I'm a First Nation veteran from Opaskwayak Cree Nation, and I'm honored to speak with you today, not only as a board member, but someone who has firsthand experience of what it's like not to have a home. Before I get started, I'd like to say miigwech to Elder Barbara Nepanak for starting us off in a good way. The street census we released this afternoon is not just it is a mirror of our community, reflecting thousands of people living without the security of a home. On behalf of the board of End Homelessness Winnipeg, I want to thank you all for being here and sharing the responsibility of this responding. This is the 5th Winnipeg street census, and with each one we have deepened our understanding of homelessness in our city. The 2024 count shows us the extent of the crisis. More people are living without housing than ever before, with Indigenous people, youth, older adults, and newcomers disproportionately affected. Behind every number is a person, a neighbor, a relative, a veteran, a friend, and each deserves dignity, safety, and belonging. The findings show us where the gaps are, but they also highlight the pathways to action. Stronger supports, more affordable housing, and coordinated efforts across systems to respond with urgency and compassion. We recognize that many partners who made this count possible, governments, community organizers, lived experience experts, and more than 160 volunteers who walked alongside people in our streets, shelters, and gathering places. Your commitment ensures that we do not look away from this reality. As a board, we carry a responsibility to use this knowledge wisely in supporting solutions, advocating for change, and holding ourselves accountable to our relatives and our communities. We are eternally grateful for the staff at End Homelessness Winnipeg, whose skill, dedication, and compassion bring this work to life. Together, with courage and collaboration, I'm confident we can move forward from counting the problem to celebrating outstanding results in providing solutions that make a difference. Our teachings remind us that we are all related. To honor that truth is to ensure that no one is left outside. Let us walk this path together, guided by respect, responsibility, compassion, until every relative in our city has a place to call home. Miigwech.
Thank you so much. So next, everybody knows Al, but I'm going to introduce him to everybody again. We're honored to hear from Al Weeb. If you work in our sector, you see Al everywhere all the time. He's tireless with his efforts. He's a lived expert and a member of the Pit Count Steering Committee, and he's also the host of the radio show of No Fixed Address. So at this time, I'd ask Al to come up and say a few words.
I knew I was going to ask. Yeah, it's a great pleasure to be here today. When I found out that, well, I'm not reading my text, I made myself some quick notes because I did not know what I was going to say today. When I found out that this year's street census was happening, I had to call Elijah, who I knew was going to be in charge of it. And as Elijah would tell you, I practically got down on my knees and begged to be back on the team this year. I've been involved since day one, back in 16, and it's always meant a lot to me. And first of all, I want to thank you for your leadership on this year. It was amazing. I disagree with the 4 days, though. Why is it important to me as a person with lived experience? I spent 29 months on the streets, and it was hell. There's nothing redeeming about being homeless. Zero. From the beer can collections and drive-through change just to survive. What my time on the street did was put a hole in my heart and a fire in my heart for folks that are still out there. And I am driven every single day, and sometimes I wish I did not have lived experience because it hurts so much sometimes. It grips me and doesn't let go, and when I want to quit, I can't let go because I feel so badly for the folks on the street today. And sometimes the hopelessness that is out there. I appreciate, as much as I criticize the province for the way home, I do honestly, I appreciate the efforts on pulling people off the street because we didn't have that before. But I'm consumed with doing whatever I can in my life to pull people off the street. And the street count gives us the data that we need. And yeah, some people say, yeah, it's just data mumbo jumbo and it's not going to go in there. This goes directly to the federal government. But without reasons for homelessness, we can't do anything. If we do not know the reasons, we can't do anything. And what the street census did was give us reasons. why people are out on the street. For me, it was mental health. I lost a career position, and I could not handle the trauma of losing a career position, and found myself, due to mental illness, on the streets of Winnipeg for 29 months. There are so many reasons out there why people end up on the street. So many folks come down to Winnipeg from the reserves to find a better life, and they end up on Main Street and never leave, and perhaps die on Main Street. I'm so torn up every single day when I read another obituary, hear about another person dying on the street, being murdered on the street. It's so difficult. I've become a huge fan of the street census, and I'm reluctant to see it change methodology next time around. But you know, what the street census does for me as a person with lived experience too is, as a neighborhood coordinator, which I have been since day one, and as a trainer, it gives me the opportunity to see new folks who've never met homeless people before. This is, for me, is one of the key things. People have never spent time speaking to anybody on the street, and they have their perceptions of who the homeless people are, and they have their stigmas and have their unconscious biases towards those folks. And you see a lot of that lifted. You know, as a person who would be sending people out into the streets, I would see them come back and have their faith. They were so elated to be able to go out there and meet folks. And you know, we have our perceptions that these people are monsters, but they're really not. They're like you and me. And when people actually find that out, it's a shock. But why do we carry those perceptions with us in the first place, right? But for me, you know, the really uplifting thing about the street census is bringing knowledge and awareness to folks that are out there doing the street census for the very first time, whether they're students or seniors, all walks of life, all ethnicities. They come in, they take their papers, and they go out and do their surveys, and they come back and say, can I go out again? I want to meet some more people. To me, that was really enlightening, because we're opening the eyes of people. We cannot change things unless we get more people on the same page, unless we get more people understanding what the homeless situation is all about, who the homeless people are. There are PhDs on the streets. There are business owners on the streets. There are people that are recently on the streets because of economic conditions. Since COVID, we've seen a rise of folks on the streets because of cost of housing and cost of food. That awareness to me is everything, because we cannot make any changes unless we bring awareness to the general population. And the street census does that. We send out how many volunteers this year? About 160? 160 people had their opinions changed of people on the streets because we were able to meet them. Come in and say, do you know that guy was a doctor? I said, well, there's a few people like that out there. And, you know, I do a lot of training, and one of the things I spend time with is removing our unconscious biases. And this is an easy way to do that, because people, it's an automatic, it's a original way of getting that done. I'm going to be disappointed not to do the street census, you know, next time around, but we need to, if we can't also make changes unless we know the reasons, and the street census gives us many, many reasons. Yeah, you know, number one and number two being addictions and mental illness. I was on the street because of mental illness and inability to lose, to handle the trauma of losing that career income. We cannot change policy unless we know the reasons, right? And I think that it's really, really important that we continue the work and show the federal government, who are hard to reach in the first place at any time, but give them absolute reasons why we should be having this funded and having that funded. And then we're going to run into a tough time with the government making cuts all over the place, so we have to be even stronger on the message to the federal government, because housing is going to get tougher and tougher to do, and I don't envy the province. But thank you so much.
Thank you, Al, as always. And finally, last but definitely not least, I want to welcome Ash Burkowski up. Ash has been, every time we need help with something, we ask them and they're there. And as a member of the steering committee, you've been so helpful as well. So as a lived expert and a member of the steering committee, it's an honor to have you share some of your remarks with us today.
Thanks, Jackie. So my name is Ash Burkowski. I work in horticulture and I volunteer at the Botany Lab at the Manitoba Museum. And I also contribute my perspective and experience as a lived experience advisor to End Homelessness Winnipeg. I worked on the 2024 street census as a surveyor, logistical support, and data entry. And I've also helped with each of the street censuses since 2018. I've been homeless both as a teen and as an adult. So I'm here to speak to you today about the importance of the 2024 Winnipeg Street Census, also known as the point-in-time count. The true measure of a society is how it treats its most vulnerable members. Many notable people have made variations of this statement over the years. It holds true today as we discuss the results of the 2024 Winnipeg Street Census. The data in the report has made it clear that we face urgent choices here in Winnipeg about what kind of future we're willing to work toward. While it will take time to consider this report, the responsibility to engage, respond, and act is already upon us. Are we a society that leads with our strengths as humanity? Cooperation, empathy, and a commitment to the common good to create healthy, vibrant, and inclusive communities? Or are we, through inaction or competing priorities, allowing essential human needs like affordable housing, supportive environments, adequate nutrition and income to be overlooked, creating conditions that no one would choose, but that we have a shared responsibility to address? We pass by our relatives enduring hardships every day as Winnipeggers. With the release of this report, we have the choice whether we want to act and create positive change or to delay and to allow the challenges we're facing to deepen. The issues leading to the conditions our relatives endure have been clearly expressed by those who gave us their time and shared their hardships and experiences so we could bring you this valuable report today. They deeply wanted to be heard. Many shared their stories with us with hope and urgency, trusting that you'll hear them today as we release this report, and carry their stories with you as you consider pathways to positive change. Working together, we have collected the data to show the challenges that are faced when you do not have a place to call home in Winnipeg. And now it's up to the leaders to consider this report and find the commitment to take real action. We need adequate incomes, both through wages and income supports, to support both those who can work and those who can't. We need accessible, affordable housing that meets the needs of both individuals and families. We need mental health services, addiction services, wraparound supports, and the removal of all arbitrary barriers to accessing those services. Recovery services and holistic care are necessary and should be easy to access. We need to show that we are a society that cares for all of its members, where everyone has a chance to grow to their full potential, where we have a healthy community and city that works for everyone. I want to thank everyone who made this report possible, in particular the individuals who shared their lives with us during the survey while we worked towards compiling this report. Thank you to all for being here today. I'm hopeful we can work together towards a better future.
Thank you so much, Ash. So I want to thank all of our speakers for all the important words that they shared and all of the insights that they shared from their perspectives. We'll now move on to why everybody is here today, to hear about what's inside the 2024 point-in-time count, also known as the Winnipeg Street Census. I'd like to welcome Elijah Yaboa, Manager of Evaluation and Shared Measurement at End Homelessness Winnipeg, and I'm proud to call him one of my colleagues. And he's also the Pit Count Program Lead, along with Ainsley Hines, a researcher at the University of Winnipeg, and our Pit Count Coordinator.
Thank you, Jackie. Hello, everyone. I'm Elijah Sayabwa. the manager responsible for research and evaluation at End Homelessness Winnipeg. I'm also the project lead. Introduction.
Hi, everyone. My name is Ainsley Hines. I just wanted to thank Elijah for asking me to be the pit count coordinator. He asked me about a year ago, and I was really honored to have this opportunity. I don't take it for granted. I feel very honored. I did my best in this job to honor the voices of the individuals who participated in the survey. I'm a white cisgender female with Ukrainian, Scottish, and Romanian roots. I am very aware of my biases, or at least I hope I am, and what I can and cannot do in doing this work. And I want to thank the steering committee, the individuals who helped with the recommendations. This really was a collaborative effort. So thanks for everyone who participated and supported this project.
Thanks, Ashley. So Ainsley and I will present the results from the 2024 Winnipeg Street Census. We will cover these areas in our presentation. We will start with what we do as End Homelessness Winnipeg. We'll provide some background information on the point-in-time count. We will speak about the methods that we used. We will share the results. Following that, we will offer some recommendations for preventing and ending homelessness here in Winnipeg. And we will end with some upcoming projects and events. End Homelessness Winnipeg is an Indigenous organization. We made that important decision to become Indigenous in 2019. And this was meant to reflect the vast overrepresentation of Indigenous peoples in homelessness. About half of our staff identify as Indigenous, and for our board, it's about 75% of our board that identify as Indigenous. Our mandate is to bring together the entire sector to work towards addressing homelessness. And as you can see on the screen here are our program areas. First is we administer Reaching Home funding. Reaching Home is a federal government initiative intended to reduce chronic homelessness by 50% in 10 years. We also administer Canada-Manitoba Housing Benefit. The acronym is CMHB, Coordinated Access and HIFIS. CMHB, it's a program that offers rent supplements. Coordinated Access is also known as Nada Muscapin, that's the Indigenous name. Coordinated Access is a system for connecting those experiencing homelessness with available housing and supports. HIFIS is a database on housing and homelessness. We also do systems change and advocacy work, and this is in 4 interrelated pillars. My pillar, the pillar that I oversee, is measurement and evaluation. So naturally, the pit count is one of the projects that I oversee. My colleague Janine in the audience, she is responsible for prevention, which is really critical because it's way better to prevent homelessness than to wait for people to experience it and then you try to intervene. My colleague Vince Spence, he's our person-centered support manager. It's vital that we treat our brothers and sisters experiencing homelessness as such. Housing supply, my colleague Justin, he is responsible for that pillar. And we know without housing, we can't address homelessness in the city. Now, I'll provide some background information on the project. The point-in-time count provides an estimate of how many people in the city experience homelessness in a day. It also helps us know what their needs are and how best to address their needs. As it has already been mentioned, this is not the first pit count. The First was in 2015, second 2018. The first two were led by Social Planning Council of Winnipeg. Kate, the IED, was here. Oh yeah, Kate is still here.
Lots of other people here, absolutely.
Yeah. And 2021, End Homelessness Winnipeg led it by ourselves. 2022 was a collaboration between Social Planning Council of Winnipeg and us. And 2024, the one we had last year, we led that by ourselves. The project is nationally coordinated and funded by the federal government, specifically Housing Infrastructure and Communities Canada. Winnipeg is not the only city that was involved in the count last year. In total, about 64 communities across the length and breadth of the country were involved last year. And it's already been said that End Homelessness Winnipeg led this project. As you were coming in, you might have seen a sheet displaying our project partners. This is a huge undertaking. We couldn't have done this all by ourselves. And I see a lot of them in the audience today. Thank you for all your contributions. We couldn't have completed this project without your help. So it comprises the different levels of government, city governments, provincial governments, federal government, indigenous governments, AMC, MMF, Manitoba Innu Association. We also work with the newcomer sector, Manson, New Journey Housing, and many other community-based organizations.
Thanks. Elijah and I are going to be switching off and on here, back and forth. As Elijah mentioned, the survey is a federally funded project, which means that the federal government mandates certain questions that we have to ask. There were around 15 questions that had to be asked, but there was a steering committee and 4 working groups. The research working group worked to revise the survey to make sure that it was locally relevant and inclusive. So we changed things like the gender question to, for example, instead of selecting one response, multiple responses were allowed, and having more response options. So there was certain questions that we had to ask, and we tailored it, and we also added a few questions that were locally relevant. And so we got feedback from the steering committee, from the working groups and others on what questions to add to the survey. If you have the physical copy, the survey is the last thing in the report. It's Appendix C, so you can see the questions for yourself. We trained a lot of volunteers, and 160 volunteers actually participated in administering the survey, plus outreach staff at a variety of different community organizations, as well as sector staff. So some community organizations participated. The survey was administered November 6th to the 9th, and then on November 12th. From the 6th to the 9th, the volunteers were assigned one of the 4 base camps. So Ndinaway-Mac, Mount Carmel Clinic, The Link, and Homelessness Winnipeg were the 4 base sites. The volunteers went to the base site, picked up the survey materials, along with the branded street census vest. There's a photo in the report of that. And they were also provided with the honoraria. They were assigned by the neighborhood coordinators, like Al was one at Ndinaway-Mac, to assign specific routes. And Justin, on the logistics working committee, created the map. So you can see there's an example of one there where it kind of outlined the path that the surveyors were to take. And then some volunteers were also assigned to go to different community organizations who hosted. So some community organizations hosted volunteers, and some community organizations had their staff administer the survey. So there's a lot of folks involved in collecting the data. We only had outreach staff who already have relationships with folks in encampments go to the encampment. So the 160 volunteers just went on the designated routes. There was folks like the survey, the outreach staff who have relationships with folks went to the encampments to respect those relationships. The participants or the survey respondents got 2 bus tickets, a pair of socks, a $5 gift card to McDonald's, and 2 cigarettes. So they received an honorarium for participating. There was a screening process, so the volunteers were instructed to approach everybody, not to base who they approach on how someone looked, to make no assumptions. They approached everyone, and at the beginning of the survey, if you look on Appendix C, there's a set of screening questions. So folks were asked, you had to be 16 or older to participate. They were asked whether they had participated before, because we were doing it over multiple days, we wanted to discourage people from participating more than once. We also asked if they wanted to participate. So we did our best to ensure the volunteers were trained to approach people in a culturally appropriate and sensitive way. So that's the survey part. And then there was a lot of surveys that were completed, over 1670. And you'll see in the next slide that there were 1,511 surveys, through the data cleaning process, removing duplicates and removing ineligible participants. The final survey sample is 1,511. So in addition to the survey, we also got data from administrative data from the Homeless Individuals and Families Information System. So shelters and some transitional housing programs input data into HIFIS. We also did tried to put out data requests to transitional housing programs that are not on HIFIS. And only one program responded and provided us with the number of people who were staying in their program. And then we also made data requests to the provincial government, 3 of the departments, or 2 of the departments and hospitals. So CFS, we asked for data, we did our best. We were not given, they did not provide us the data. Same with justice. We tried really hard to get provincial justice data about how many people were released on the day of the count, and they did not provide us with data either. We did get data from Winnipeg hospitals. So they're the folks who were experiencing homelessness in the hospital on the day of count are included in the total. So what I want to just emphasize right now is that there are limitations to this survey and to the whole methodology, and they're outlined in the methodology section of the report. We figure that this is still an underestimate of the total number of people experiencing homelessness. And the limitations section outline all the ways in which, or at least all the ways that we could think of, that the methodology is limited. So the estimated number of folks who were experiencing homelessness on the day of the count. So although the survey was administered over 5 different days, the first question, or the first question on the survey part, was asking where folks were on November 5th. The total number of people, combining all the different sources of data, is 2,469 people. This is the highest number of folks reported to be experiencing homelessness in the 10-year history that the count has occurred. And again, this is, we know it's an underestimate. Also, I just want to, because the methodology is more comprehensive than any other PIT counts in the past, there is limitations. So please interpret the numbers as like, interpret as indicative or patterns as opposed to precise estimates, because we know we did not, it represents a sample, not the whole population. Okay, so on where were those 2,469 folks staying on the day of the census? So the slides that Elijah and I are going to be presenting from here on out, it's just based on the survey data, because the administrative data it only tells us the number of people, but we don't have the details. So the information from here on out is strictly based on the survey. So the day of the count were the 2,469 people, well, here it's based on the survey. 37% were provisionally accommodated. So that means that they were either staying with someone else in a hotel or motel, either self-funded or part of a program, in hospital, in treatment center. They may have been incarcerated or in a transitional housing program or shelter. Almost a third, or 3 in 10 people, were at a shelter, and that includes emergency shelters, family and domestic violence shelters, as well as like the drop-in like We24. Almost 3 in 10 people were in an unsheltered location, so that includes living in a public space, such as an abandoned building, a bus shelter, or in an encampment, and I just pulled the number out there. So of the unsheltered, 7.9% were in an encampment. There were the data is not perfect, and sometimes it's kind of hard to tell. Responses that we were not quite sure about where people were based on what they shared, or they had said that they were in multiple locations, so that was 4.5%. And then 0.6% or less than 1% were permanently accommodated. And you might be thinking, well, if they're permanently accommodated, how are they experiencing homelessness? Well, there was, if you look at the survey, there's a follow-up question. If someone said that they were staying in an apartment, like their own apartment, the next question asked, is it a safe and permanent place to stay? And if they said no, then they were included as experiencing homelessness. So another question on the survey asked if they had been staying with anyone else on the night of the count, which included pets. So about 3 in 10 people, or 30%, said that they were with someone else on the night of the count. And that included other adults, so 20% were with, or 19% with another adult, around 10% were with a partner, just under 3% were with their children or a dependent, and less than 1% were with a pet. And then another question in the survey asked where folks had stayed in the year prior to the survey. So to try to get a picture of all the locations that people stayed. So 86% had been in one of the shelters, or at least has stayed, has stayed in at least one shelter in that 1 year period. 67%, or 2/3, had been provisionally accommodated. And then almost 60% had been unsheltered. And then you can see on the right side there's the breakdown in more detail.
We wanted to know how long people had experienced homelessness. So we asked them in the year prior to the survey, which would have been from November 2023 to November 2024, in total, how much time they were without housing. And more than 2/3 of our survey respondents, which will be 67.9, didn't have housing within that, more than 2/3 didn't have housing for at least 6 months within the last 12 months. Now, if you look at the mean is the average, right? So the average survey respondents was without housing for 9 months within the 12 months preceding the survey. Now, let's look at the median. The median is the middlemost number, and the median was 12 months. So what this means is at least half of the survey respondents were without housing the entire 12 months, from November 2023 to November 2024. And Reaching Home has two definitions of chronic homelessness. One is if you have been without housing for 6 months in the last 12 months, or if you've been without housing for a year and a half in the last 3 years. And by the first definition, clearly the majority of them were without housing. But the reality is we don't want people experiencing homelessness for a very long time. Because if someone is experiencing homelessness for a very long time, it gets to a point they can even keep up on finding housing. The second challenge is even if they find housing, right? Let's say someone is living downtown for 3 years without housing. They've made friends within that area. So all of a sudden you house them in the southern part of the city, St. Vital. All their friends are still living downtown. So they might even leave the housing that you provided for them, which is another downside to chronic homelessness. By the second definition, 63.6%, that would be 6 in every 10 survey respondents, were without housing for a year and a half within the last 3 years. Homelessness affects all age groups. The average was 49. If you look at the breakdown, youth, we define youth as from 16 to 29 years. Youth were almost a quarter of our survey respondents. Adults from 30 to 49 were more than half, 52.4%, and older adults, 50 plus, were a little over a quarter. And if you revise the age bracket for seniors, if it's 65 plus, that would be 2.9% of our survey respondents. And sadly, if you look at the right side of the screen, there was one person who was 91 years old. As a society, we want to be able to take care of our seniors. No one wants to be at that age and be without housing. So clearly, there's a lot of work ahead of us. We also wanted to know when our survey respondents had their first homelessness experience. And you can see the tallest bar is age 18. But the question is, why age 18? It's 18 because a lot of the survey respondents had prior CFS experiences. They were in CFS. They aged out of CFS when they were 18, and unfortunately, they didn't get any support when they were transitioning out of CFS. We've heard of stories where CFS workers will literally drop people off at shelters. And what this report has done is to confirm these stories and the anecdotal evidence we've gathered with time. We also were interested in what factors accounted for their most recent housing loss. There were a lot of responses that were provided, but we tried to consolidate them into 9 categories. The first category was housing and financial issues, and that was almost a half of the survey respondents. If you break that down, the common responses were low income, almost 1/3 of the survey respondents. And I'll come back to that later, because over 60% of our survey respondents were on EIA, and ideally, if they're on EIA, they're supposed to get enough income to be able to afford housing, but fortunately, that wasn't the situation. Unfit or unsafe housing conditions, 8.7, damage to the property, 3.6, conflicts. Conflict could have been with their spouses, with their landlords or caretakers, 7.7. It could have been with their parents or guardians. And for youth, this was one of the main reasons why they lose housing when they have a conflict with their parents or guardians. Health, substance use 16.2, mental health, I'll talk about mental health 8.0, physical health issues or disability 6.7, eviction alone 16.8, illegal entry 0.7. There were many other reasons. Now, we were interested in where they were getting income from. As I mentioned, over 60% of the survey respondents were relying on EIA, but if they were relying on EIA, they were still experiencing homelessness. That suggests that they weren't receiving enough. The EIA amount is very low. And unfortunately, the EIA amount is not tied to the cost of inflation. So as the cost of living goes up, it's not tied to the cost of living, sorry. So as inflation goes up, as the cost of living goes up, EIA amount doesn't keep up with the cost of living. Informal income sources were 15%, EI 9.3. Interestingly, there were 5.5% of the survey respondents who were relying on their social capital, so money from family members and friends. GST, this is also interesting, 5.1. If you look at all our survey respondents, they would be eligible for GST refund. But if only 5.1 were receiving it, this also tells us that they were not filing their taxes, right? So this is an opportunity to help our brothers and sisters get all the benefits that they are eligible for. And 19.4% of the survey respondents did not have any income at all. Again, all our survey respondents would be eligible for EIA, so if close to 20% were not receiving it, if close to 20% did not have any type of income, then this shows that there's a lot of work to be done regarding removing the barriers to accessing EIA, and then once they're on EIA, continuing to receive it.
There were almost 91% of the survey respondents had one or more health condition. And this just shows the breakdown of the health conditions or issues that were asked in the survey. So almost 3/4 had a substance use issue, condition or challenge. More than half had a physical mobility or a mental health condition. So these are self-reported. Mental health could be diagnosed or undiagnosed. So the physical mobility needs to be considered when designing housing, especially if folks have accessibility needs. A substantial portion had a learning, intellectual, or developmental or cognitive function challenge. And about 4 in 10 had issues with their senses, so hearing or seeing. And again, 4 in 10 had a chronic long-term condition like heart disease or diabetes. 30% or 3 in 10 had short-term illness or injury, and 27% had a brain injury. If you look also, so these are just the overall values. If you look in Appendix B, the health conditions are broken down by the different demographic characteristics. If you're interested in seeing how indigeneity, gender, and sexual orientation vary by the different health conditions.
We wanted to know if they had prior experiences with CFS, and almost half of them said yes. That was 48.8%. Unfortunately, when it comes to CFS, our Indigenous brothers and sisters are overrepresented in CFS. So Indigenous respondents were 3.5 times more likely to have been involved with CFS than those who were not Indigenous. And almost half of them who were in CFS, they stayed until their 18th birthday. We wanted to know their housing outcomes once they transition out of CFS, and what this slide is showing is less than half had permanent accommodation once they left CFS, which confirms that for a lot of them, they leave CFS, they don't get enough support, so they end up experiencing homelessness. I've talked about the fact that Indigenous people are vastly overrepresented in homelessness, and what this pie chart is showing is that Indigenous people constituted about 80% of our survey respondents. So that would be 8 out of every 10 survey respondents. First Nations alone, they constituted 62.3%. So that would be 6 out of every 10 respondents. Métis were 15. Inuit were 0.4. Other Indigenous ancestry 1.7. And those who were no Indigenous were 20%. To put that into perspective, for Winnipeg, Indigenous people constitute about 12.4% of the city's population. So when it comes to the entire city, they're just 12.4, but when it comes to homelessness, they're as high as 80%.
About half of the survey participants were men or male, and 40% were women or female, and 5.5% were transgender, non-binary, or another gender diverse response. And then about 3 in 20 people were part of the 2S LGBTQIPA plus community in terms of their response to their sexual orientation. But then if you combine gender and sexual orientation, 17.7% were a part of the 2S LGBTQIPA community. A small subset had served in the military and or had been members of the RCMP. One of the questions on the survey asked, had you always lived in Winnipeg? It was about almost an even split, so almost half had always lived in Winnipeg and half had lived elsewhere. And then if folks had lived elsewhere, the surveyors asked where they had lived before. And it was an open-ended question. So based on the responses and what we were able to code and like Google where locations are. So about half of the people that had lived outside of Winnipeg had lived in Manitoba. The next slide, you'll see the transition map from where folks came from outside of Winnipeg, but within Manitoba. 33% had lived elsewhere in Canada, so outside of Manitoba, but still in Canada. And about 13% had lived outside of Canada. The numbers don't add up to 100%, and that was because some of the responses, it wasn't possible to determine, like if they set up north, whether that was in Nunavut or in Manitoba, for example. So there was some that weren't classifiable. Of those who had moved to Winnipeg, about a quarter had been here less than a year. And then and some folks, like 44%, had been here for a very long time, over 11 years. So here's the Manitoba transition map. So this map was created by Matthew Altieri. Just shout out to him. He was awesome to work with. So this map shows where folks came from before they moved to Winnipeg. Please note that the 0 to 6 are combined. So there are 17 areas represented here in this map, but there's actually more like 50 different areas in which people are from. The darker the area, the more folks were from that area. And the top 5 are highlighted here, or pointed out here. There was a question on the survey that asked, when people, so right after if they'd always moved to, or always lived in Winnipeg, when they moved to Winnipeg, had they experienced any challenges? So 62% of the survey respondents had experienced challenges when they moved to Winnipeg. And then it was asked as an open-ended question, what kind of challenges did you experience? And in the quote bubble there, you can see some of the responses. So things to do with not being able to afford rent, finding it hard just to find a place, not having someone who can be a reference for you when you're applying for an apartment, and language barriers. So there was a whole host of responses to that question. And then for those who weren't always living in Winnipeg, they were asked if they had come to Canada as an immigrant, refugee, or refugee claimant, or through another process. So 12.9% of the survey respondents are like newcomers, so refugees, immigrants, refugee claimants. Of those who were newcomers, 55% of them were refugee claimants. And I forgot to mention, in part of the methodology, when I was doing the methodology slide, I forgot to mention that we held 2 magnet events. So magnet, you can think of what about a magnet is, like drawing, like a magnet draws people together, or that's what it was supposed to do in this instance. So we held 2 magnet events, and they were specifically for newcomers. So we had one at Welcome Place and one at the 180 Henry, where newcomers were. So we specifically had these events where newcomers were to try to meet them where they're at. And as part of recruiting volunteers, we asked whether folks spoke multiple languages. So when we were assigning volunteers to locations, we did our best effort to place multilingual speakers, like to schedule them for those 2 magnet events. The primary languages were French and Arabic.
We know one of the pathways into homelessness is discharges from hospitals. And so we had asked the survey respondents if they had ever been hospitalized within the year preceding the survey, and almost half of them said yes to that question. And if you look at the yellow bar represents those who have permanent accommodation upon discharge. So that means that over 88% were discharged into homelessness. We also wanted to know their interactions with these services. Emergency. So over half of them had been to an emergency department in the year preceding the survey, which I think is very concerning, because for Winnipeg, we know our emergency units are notorious for their wait times. No one is happy to go to the emergency, particularly because of the wait time, right? And it also costs money to provide that kind of service. So if a lot of people are using the emergency service, this is a big issue that has to be addressed. And I should also add that in another report, we had asked people who were experiencing homelessness why they went to the emergency department. And the 4th reason was they wanted a place where they could get food and warmth, right? So if they are going there and it's not because they are really sick and they need urgent medical attention, if we're able to house them, it will help us save a lot of money. The second is incarceration, the justice system. Prisons, I should say, are the most expensive form of housing. The federal government said that it costs them $589 to keep a woman incarcerated a day, right? In a day, it costs them $589. Let's just do some math here. To make the calculation easier, let's just run it off to $600. If you multiply $600 by 30 days, that should be how much in a month? That would be around $18,000, right? I don't think there's anyone here who pays $18,000 for their rent or for their mortgage. And we can house people and provide them with wraparound support with a fraction of that amount. So what are we waiting for? Ambulance, that is also another expensive service to provide. Almost half of them have used an ambulance in the year preceding the survey. Substance use treatment facility, 22%, supervised consumption service, 18%. We wanted to hear from the horses' own mouth the supports they need to find housing and maintain it. And these were their responses. The first two, I talked about the importance of income. And you see that the first two factors are related to income. One was more affordable housing. The second was housing subsidy or benefits. The third was help with housing applications, help maintaining housing, 70.9%. Mental health, we've already talked about that, 66.4%. Employment and educational related supports, 49%. I should add that there's a strong correlation between education and homelessness. In the 2022 street census report, we found out that more than half of the survey respondents did not have high school education. And realistically, if you are in this economy and you don't even have high school education, it's very difficult to find a decent job to be able to afford housing. So we need to support our youth to stay in school longer, pursue post-secondary education, so it can increase their chances of getting a very good job. And that would also help them be able to afford housing. Other factors were substance use, help with ongoing medical condition, community, culture, and connections.
So we're going to get into the recommendation section now. It's on page 27, if you're curious. So the way that it's written is that the recommendations are organized into different sections. I'm going to present the recommendations from the first three sections, and Elijah will present the recommendations from for the last. There's 13 recommendations in total. They're organized so that you have the recommendation, and then you have the rationale, which is based on the results of this report, as well as I worked really hard and had lots of help and collaborated with folks to make sure that these recommendations are actually actionable and they're actually what is needed. So they're informed by folks like Justin and Janine down here, and a bunch of other folks who helped with these. So thanks to everyone who helped with developing the recommendations. I also want to give a shout out to Nathan Bradburn. He is the individual who did the graphic design and did all the infographics. He is a Red River student. I was just like so proud of him. He worked so hard. He was so receptive to feedback. And I think he did a fantastic job. So shout out to Nathan. Okay, so I'm going to start here in the findings. So the findings show us that homelessness is not only a housing crisis. It's about health, child welfare, justice, income, and community support. People are entering homelessness too quickly, staying in it too long, and facing repeated cycles of losing housing. If we want to change this, we need to do three things. We need to slow the progression into homelessness. We need to move people out of homelessness faster, and we need to stop people from ever experiencing homelessness in the first place. This means that all levels of government have to invest and commit. It also means new policies, better coordination across services, and making sure people get person-centered supports that meet their needs. The recommendations we're sharing are grounded in the voices of the people who have lived experience through the data collected in the survey, and like I said, by experts who we collaborated with in developing them. They're practical, they're urgent, and they call for accountability. So if Winnipeg is serious about ending homelessness, this is, I hope, is a roadmap. That's my intention. What is needed now is commitment from governments, from organizations, and from all of us as a community. So the first set of recommendations focus on foundational systems reforms. These are changes to large systems like income assistance, corrections, child welfare, and justice. The street census suggests that there are gaps and barriers in these systems, and they contribute to people becoming homeless. So the first one, I'm just going to go through them. So nearly 1 in 4 people we surveyed were under the age of 30, and most common age of first experiences of homelessness was 18. So we need the Manitoba government to lead a coordinated multi-system response across child welfare, schools, justice, health, and other systems so that young people don't get left behind during this critical life stage. They should use a rights-based framework guided by reconciliation and best practices like duty to assist model, ensuring that every youth has a safe place to call home. The second recommendation, the results suggest that homelessness and incarceration are connected. 3 in 10 people surveyed had been incarcerated in the year before the survey. And we know anecdotally that people are released straight from incarceration into shelters or the streets. So this is a sign of systems failure. We are recommending legislating mandatory pre-release housing planning so no one leaves provincial custody without a verified housing placement and connections to supports. So the Manitoba government should fund transitional support teams working with community partners to provide housing, reintegration, and follow-up supports after release. The third recommendation. So nearly 1 in 5 people surveyed had no income at all, and less than half were receiving EIA, even though most had applied. Too many people are being excluded by barriers in the systems. Through the survey, people told us that it's complicated paperwork, lack of ID, communication breakdowns, and discrimination made it hard for them to get and keep their benefits, pushing them towards unsafe survival strategies instead. So we recommend reducing barriers to EIA by allowing conditional approval without ID or an address, expanding EIA staff presence in shelters and community sites, improving caseworker availability, and making benefits more compatible with part-time work. The fourth recommendation. So a third of people that were surveyed said they lost their housing because their income simply wasn't enough. So over 80% said that better income supports or rent subsidies would help them get out of homelessness and stay housed. Current income and rent supplements programs fall short of covering Winnipeg's actual cost of living, especially with rents rising and affordable housing being in short supply. So we are recommending raising EIA rates to reflect real living costs, relaunching and expanding rent supplements, and ensuring these programs reach all low-income Manitobans so that no one is left behind. The next set of recommendations. So the next set focus on population-specific and transitional supports. These are targeted measures for groups who face unique risks of homelessness, such as Indigenous people relocating to Winnipeg or young youth aging out of the child welfare system. So the street census highlights the need for tailored supports that address these critical transition points and prevent people from falling into homelessness. So the first one, many Indigenous people experience homelessness after moving to Winnipeg, even though there are organizations like the Eagle Urban Transition Center and Friendship Centers that provide supports. So current services are not preventing housing instability. The survey findings and past research show that people often arrive with temporary housing arrangements, limited pre-arrival planning, and few options if those arrangements break down. These challenges worsen during evacuations such as wildfires or floods, where gaps in safety and coordination are especially serious. So we are recommending strengthening transition supports with permanent funding for Indigenous-led organizations better pre-arrival and service planning, and coordinated evacuation plans to prioritize safety, cultural supports, and community connection. The next one, the street census, the results show that the child welfare system is a pipeline into homelessness, as nearly half of the respondents had been in care, with Indigenous youth dramatically overrepresented, yet only 43% had stable housing when they aged out. So we're recommending creating community navigators who are trusted adults based in community hubs who connect with young people before, during, and after leaving care. These navigators would provide long-term consistent support from the ages of 16 to 29. So with sustained government funding, community partners could deliver this support, helping young people avoid service gaps, navigate adulthood, and build stability after care. The last set of recommendations that I'm going to go through. So the next set focused on housing supply and design, highlighting the urgent need for more deeply affordable housing and models that meet the diverse needs of people experiencing homelessness. So the first one, the street census shows that the #1 reason people lost their housing was financial. Nearly half of the respondents cited housing or money issues, and 1 in 3 said they simply could not afford rent. More affordable housing was also the top need people identified to exit homelessness, with 82% saying that's what they would need to secure and keep stable housing. So we are recommending a major increase in deeply affordable housing, deeply affordable rent-geared to income housing, supported by all levels of government, along with measures to preserve existing low-income options like rooming houses and to ensure developments move more quickly. And then the last one I'm going to present. So the last one is, the street census shows us that homelessness in Winnipeg is not experienced equally. Indigenous people, 2S LGBTQIA+ community members, youth, newcomers, and people with disabilities are all overrepresented in the population surveyed. So more than half of the respondents also reported mobility issues, which many had sensory impairments or cognitive conditions, and almost 1 in 3 had experienced a brain injury, highlighting the urgent need for accessible, tailored housing. So we are recommending that the governments fund housing models designed by and for diverse communities. So this includes Indigenous-led, 2S LGBTQIA+ affirming, youth-specific, newcomer-focused, and accessible housing so people can find a home that actually meets their needs.
I'll continue with the recommendations. We need to enhance access to services such as income tax filing to put more money in the pockets of our brothers and sisters experiencing homelessness. We've talked about the importance of getting an ID. You need an ID to access EIA. You need an ID to open a bank account so they can even pay the EIA amounts. And the other benefits that our brothers and sisters experiencing homelessness are eligible for, so they need support to be able to access these benefits. We also have to increase mental health supports. We've already talked about that, to help people find housing and maintain their housing. We also have to decrease the amount of time it takes for individuals to get housing through coordinated access. And to be able to achieve this, obviously, we would have to increase housing supply significantly, because without housing, there's not much that coordinated access can do. Ainsley talked about the challenges that we had with getting relevant data, getting data from CFS, getting data from Justice on how many people they discharged into homelessness. Our plan is, with the next pit counts, which will take place this fall, we will continue working with them, and hopefully we'll get to a point where they will share the data with us. So here are some upcoming projects and events. Once we wrap up the 2024 Winnipeg Street Census, we will focus our attention on the next pit count, which will, as I said, which will take place this fall. From there, we will have Gigi. Gigi, it's our service expo. It's been scheduled for September 12 from 10 in the morning to 3 p.m. After that will be our AGM, which is scheduled for September 24th of this year from 1 to 4 p.m. And then towards the end of the year, we will have our second Ending Homelessness Together conference at the Canada Inn's destination. That is at Polo Park. Thank you all for your audience, and I also want to use this opportunity again to thank everyone for your contributions to this project. We couldn't have done this all by ourselves. My supervisor, Jackie, she's been a great help. We have to make some important decisions, and whenever I needed her approval for anything, she would say yes. So thank you so much, Jackie, for that. My colleagues, you have done a lot to help us complete this project. The many contractors that I hired for this project, Ainsley has put a lot of efforts into this project. Can we all give her a round of applause? And then the streets, sorry? Could you put the last slide back up, please? Okay, sure. And the steering committee members, we put together 4 working groups. All those who sat on the working groups. There are many others that I haven't mentioned, but I want you to know that we truly appreciate all your efforts, and EHW will be eternally grateful for your contributions to the reports. Thank you again.
All right, so just in final remarks, thank you to Elijah and Ainsley, not only for today, but it's a 3-year process to do this and all the volunteers. So thank you for leading us through the findings of the street census and your continuous dedication to the work of this street census. As we bring the program to a close, we'd like to thank everybody here for your presence today and your continued commitment to addressing homelessness in our city. I'm also pleased to share that the 2024 Winnipeg Street Census report is now available on our website. There's a QR code here, but you can go to our website as well if you'd prefer. I think we have a copy of it that we can put up here as well. I think we have a little bit of media left in the room. Most went to interview the minister when she was finished, but for anybody that's in the room from the media, just note that we are going to hold a scrum in room 4M46, which is just to the right down the hallway. It's just the next room over, and that'll take place. It was supposed to be 3:30 to 4, but I think we're a little ahead of schedule, so that's even better for everybody. And so thank you again, and I hope everybody has a wonderful afternoon, and we look forward to hearing from folks and the good work that's happening in community.